Hey, what's up, everybody? Welcome back to another episode of the Dude Nurse Show. Thank you, everybody, for tuning in. Definitely appreciate the support. Today, we're going to talk about something that at some point in time can and usually will affect somebody in some way, and that is health insurance. A lot of people have the misrepresentation that if they have insurance, whatever that was ordered by the doctor or was ordered by a hospital is just going to be covered no matter what. You know, your insurance is gonna cover it. You know, they say, I have insurance, I pay my premium, I should be covered. Well, unfortunately, that's not always the case. Largely, it depends on what kind of insurance you have. If you have Medicare, for example, and your provider, your doctor, has ordered home health, let's say, for you, that's where, you know, basically services are rendered in your home, wherever you reside. The only exception to that would be in a nursing home. Now, I don't know if that's specific to the state of Texas, but I don't think so. I think that's a federal regulation. You're not necessarily a regulation, but the nursing homes, you know, if you need skilled care, the nursing home has skilled staff. So anyway, so they've ordered the home health, and you know, you need physical therapy, and you need speech therapy, and you need nursing. Well, the more of these disciplines that are going to be in on your case, you know, likely the fewer overall visits, you know, you're going to get. Unless, again, like I said, you have Medicare. All home health companies in the United States, they all want Medicare. Medicare reimburses the most. Even though a lot of commercial insurances, you know, like your Blue Cross Blue Shield, those kinds of folks, a lot of times, you know, they're following Medicare guidelines, but their reimbursements are just low. I mean, for example, when I used to run home health companies, I was an administrator, I was a director. You know, my cost per visit might be, you know, $100. Well, the insurance company might only pay me $110. So there's a very, very, very narrow margin there. So basically, like I said, it really depends on what kind of insurance you have. If you what I recommend, and this is how you can really empower yourself. What you want to do is, if you're, let's say you have a stent in the hospital. Let's say you fell and, you know, broke your knee. You had surgery. You spent a few days in the hospital after surgery, like a day or two, and then they send you home, and they say, we're going to send you home with home health. We're going to have a nurse look after the wound to make sure that the dressing is good, and we're going to have a physical therapist. You know, we're going to continue IV antibiotics, blah, 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 blah. So when you're looking at which home health to go with, you know, keep in mind that one home health can't really provide anything more than the other. They're all bound by the same regulations, and again, they all fall under what's called CMS, Center for Medicare and Medicaid Services. And again, it doesn't really matter what insurance you have, they're still gonna, you know, kind of default to those CMS guidelines. So, you know, don't think that, oh, well, if I go with this home health, I'm gonna get all this extra stuff. That's just not true. Even though some of these companies, you know, may promise you that, and there are a lot that do, and that's extremely unethical for them to do that, because same thing with hospice. They cannot offer things that, you know, another hospice can or can't offer. You know, again, it's federally regulated, The only exception being with hospice is if they're a not-for-profit. That's a different kind of story, and we won't get into that. If you guys would like to hear some more about that, please leave comments down below, and I would gladly do an episode on that. So, anyways, back to where we are. So you choose your home health company. You have your diagnosis of your left knee surgery. What you need to do is call your insurance company and have a conversation with them and find out, how many visits am I approved for? What is my out-of-pocket cost? Do I have a deductible? Do I have a copay? Do I have a co-insurance? A lot of these things differ greatly. And what the biggest frustration that I found for patients and families is this in a nutshell. Same example with surgery. So an insurance company, say Blue Cross Blue Shield or Aetna or Humana, whatever, they've said, we're going to give 20 visits, 15 visits. Well, the patient, gets this information, the home health company gets this information, but then at a certain point, the insurance company stops approving more visits. You say, well, wait a minute, you approved 10 visits, 15 visits. What happened? It's really, really, really confusing. Even if here's the other side of that. Even if, let's say, that same insurance company approve those 10 visits or whatever, and the physical therapist goes out and sets a plan of care, and you get 4 physical therapy visits. Well, at the end of that, the physical therapist does a reevaluation. Let's say you get approved for 5 PT visits, okay, physical therapy. So that first visit, which is going to be the initial evaluation, that is going to be done by the physical therapist, okay? And your discharge visit, whenever that is, those 2 come out of the 5, okay? So you're essentially going to get only 3 visits of actual therapy, because when the therapist is there, he or she is not going to be, doing exercises with you, doing all this stuff. They'll do a little bit of education and so on and so forth. Same thing at the discharge visit. They're not going to be there to actually, provide therapy for you. So right off the bat, those 2 visits out of your 5, that's 40% of your visits that actually aren't visits. Then the other 3 visits are going to be provided by a PTA, physical therapy assistant. Why? Well, it's a lot cheaper to send a physical therapy assistant than it is to send a physical therapist. So the mindset of the insurance company is that, hey, we'll send the physical therapist out there to establish the plan of care, but then we'll send a PTA out there to carry out said plan of care. It's the same thing, as an RN, as a nurse practitioner, I can go out, well, we'll just say RN because nurse practitioner is a little different. But as an RN, I go out, I can establish a plan of care, and then I can delegate, and by virtue of me, writing it down, typing it up, whatever, essentially putting it in the chart, the LVN or LPN, depending on what state you live in, can go behind me and do what I've said that they can do. They have to follow my instructions to the T. They can't deviate from them. I can't, if I tell them, hey, I don't want this patient to have a shower, I want them to have a bed bath, I'm concerned because of, they're a fall risk, or I'm concerned because of whatever. If they get that patient out of bed against my instructions, they're going to be in trouble. They're operating outside of their scope of practice. So they would have to call me and say, hey, Greg, this patient is requesting to have a shower. Is it okay? So then, I might talk to, the LVN or LPN and say, well, tell me about their vitals. How are they steady on their feet? Kind of what's going on. And I might okay it. I've done it in the past. But usually if I say that, hey, I don't want them out of the bed, even for a bath, there's a very good reason. So anyways, back to my scenario with the therapist. Um, that's already, like I said, 40% of your visits are just to do the eval and the discharge. So, but insurance companies, they don't tell you that. They just don't. I don't know why. They give you the false sense that, hey, yeah, we approved 10 visits. And the home health company's going, yeah, we got 10 visits. Well, 2 visits into it, the insurance company has cut them back. And we're like, whoa, wait a minute. I've even seen it where an insurance company has come back to us and say, yeah, we're going to go ahead and approve another 5 visits. It's like, wait a minute, we've already discharged that patient. They came back to us after the fact, because once we reach that 5th visit or 4th or however many they order, we can't go past it because we don't have authorization. Even though, like I said initially, the insurance company makes out like, oh, well, I handed out, 20 visits. It just doesn't work that way. So back to talking to your insurance company, you need to call them, like I said, and ask those questions. How many, what are you going to authorize? Because the doctor, he or she, the provider, they've already written the orders, they already have all that, you've already been approved. So you need to ask them, talk to me about your approval process. How many visits are you going to approve? How many visits are out of that number? You can ask them, of these visits, does the admission and the discharge count? And they'll be like, wait, what? This person's actually really prepared. But like I said, again, talk to them about your out-of-pocket cost, if you have a co-insurance, if what is the deductible for home health. So basically what they'll kind of do is, they'll provide so many visits for home health, and then after that, if you still need treatment, they'll likely send you to inpatient rehab, or I'm sorry, outpatient rehab. So and for a lot of folks, that can be strenuous, because the injury that you have or the condition that you have may prevent you from driving. The medications you're taking for said injury or illness or whatever may prevent you from driving. You may live alone. You may not have friends or family nearby. There may not be public transportation in your area. So if you run into those kinds of issues, then you need to be asking for a social worker to be on the case, because he or she can help you with resources. It's not that your insurance companies don't want to pay necessarily. They would much rather pay a home health company to treat you for 2 weeks than to let you stay in the hospital even for 2 or 3 days. I mean, that hospital bill, just an IV fluids alone, just normal saline, cost them $1,000 a day. Hospital stays are ridiculous. Again, not going to get into that in this episode, but again, if that's something you guys want to talk about, hospitals, how they bill, that kind of stuff, just let me know. But suffice it to say that whether you believe it or not, healthcare is a business. Again, we're not delving into is it a privilege, is it a right, is it all of these kinds of things. I'm just trying to help you with how you can kind of circumnavigate some of these barriers that you may run into, because I'm telling you, when I was a director, when I was an administrator, I ran into this kind of stuff all the time, and patients would be very angry, because they say, well, nobody ever told me that I was blah 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 blah. Well, and again, I mean, that is incumbent upon the home health to be talking with the patient, but sometimes, we wouldn't have the information until it was too late. They wouldn't approve it until after the fact. And so it's just unfortunate. But, the most important thing, as I said, is 100% without a doubt communication, asking questions. Ask questions. That is your biggest weapon in healthcare. Asking questions. Honestly, if you don't ask questions, shame on you, because it's, yes, while as a provider, I have a right, or I have a duty to take care of you, but at the same time, I can only go so far. I can't make you do anything that I'm recommending that you do. I can't hold a gun to your head and say, take your insulin. I can't do that. So if you're not taking your insulin because, gosh, it's, maybe the dose is a little too high, or maybe, you have some sort of side effect from it, or maybe, you don't know how to administer insulin. If I'm doing, my teaching and all of these kinds of things, and, you're going, yes, and, we go through it once and you show me, okay, yeah, I know how to do it, but if you get home and you forget, or, you think, oh, well, what did he say? Did he say do this in the belly button, or, around the belly button, and alternate the sites, and, for the injections? You need to ask questions. You need to. And it's, again, not just your insurance company is actually part of the treatment team, because they're the ones that are paying the bill. So if there's ever any kind of holdup as part of that team, you need to be trying to figure out where the holdup is, trying to get it straightened out. The home health company, or the hospital, or the skilled nursing facility, the inpatient rehab, whatever, they're definitely there to help you do that. But the biggest thing that you can that I hope you take away from this, is that it is 10 million % incumbent upon you to be your own advocate. And if you do that, you will be a more informed patient, which means you're going to be more likely to comply. You'll be better at doing the things that we're asking you to do to try to help you get better. Like I said, whether it's home health, whether it's taking a series of medications for 2 weeks or 3 weeks, or maybe you're going to be on it for the rest of your life. You need to know, the who, what, when, where, why, how, all of those things, as to how to safely administer that treatment, whether it's, even changing a dressing, or, if you have an indwelling Foley catheter that you're going to have forever, or if you have, say, an ileostomy or something because you have, bowel issues, and, whatever the case may be, you need to know all of those things: the who, what, when, where, how, why. And if you don't ask, or as I tell people, the dumbest question is the one that you don't ask. Guys, that's it for this episode. Thank you so much for tuning in. Hope you guys enjoyed it. Comments, questions, concerns, please leave them down below. And the biggest way that you guys can help grow the channel is to subscribe, hit that notification, sign up for, go to thedudenurse.com. You can connect with me. You can see these podcasts there, the video. They're on Apple, they're on Spotify, they're on Google. My show's in a lot of places. So hopefully you guys are getting something out of this. It's truly a blessing for me to be able to do these. And thank you guys so much for tuning in. Stay safe.